Hi, and welcome to the Psych Health and Safety Podcast. My name is Jason Van Schie, and I'm one of the hosts of the show. The aim of the podcast is to rapidly increase the knowledge and application of psychological health and safety in workplaces worldwide. To help with this, we have regular guests from around the world who are leading the way in this important area. But before I introduce our guest and topic for today, allow me to introduce my special co-host for today, all the way from Melbourne, Dr. Alicia Pappas. How are you today, Alicia?
Hi, Jason. I'm doing well. How are you?
Yeah, really well, thanks. I think we were talking about this before. I think this is the first time that we've actually co-hosted together where we've had a guest on.
Yeah, I think we've done a live panel event, and I've had a couple of podcast episodes with Joelle, but not with you yet. So first time.
First time, and let's hope the audio goes a little bit better than last time when you did a co-hosting with Joelle.
Yeah, for sure.
Yeah. So what's going on in Melbourne?
Well, I've actually just come from, I've spent the morning and half the afternoon in the CBD. So as you know, I work remotely. You're in Perth and I'm in Melbourne, but yeah, I had some people to catch up with and an event to go to in Melbourne CBD today. And I must say, because it's rare for me in this post-COVID world to work not from home. There were people about, but it's still on the quiet side. That's not what I'm used to. So it's good to see people out and about, but still quiet in the CBD.
Yeah, it's still pretty unusual for us to have face-to-faces. Even if people are, in Perth with us, then we're often doing Teams calls still rather than face-to-face. So it must be nice, hey? You actually caught up with a few people today.
Yes, it's a nice change.
Yeah, looking forward to it. There's some conferences that are starting up, so we'll be doing a bit more traveling around the country. So hopefully run into a few of our listeners in a face-to-face context, which would be really nice. But hey, we've got a really great guest on today, so I should probably introduce her in. Okay, so this person has a diverse background, including secondary teaching, senior public sector management, leadership in OHS and emergency services, and organizational development consulting with a focus on workplace health. She's the inaugural CEO of the Emergency Services Foundation. Welcome to the podcast, Siusan MacKenzie.
Hi, nice to be here.
Yeah, great to have you on. Alicia says great thing. She's seen you present previously on the topic. So yeah, really looking forward to getting to the agenda with you today.
Yeah, pleasure.
Awesome. So we might kick off, Susan. Being a podcast, we ask all of our guests what their favorite podcasts are. So I was actually, my first appearance on this podcast was as a guest myself, and I don't actually have a lot of time to listen to podcasts, but I was listening to this podcast because it's in my area of kind of expertise and subject matter expertise. So I know you've told me before that you're not an avid podcast listener, but if you've got any podcasts that you listen to, what would they be, or where you get your maybe information from?
Yeah, no, look, I don't have time to listen to podcasts, to be honest. I listen to the podcasts that we do at the Emergency Services Foundation to make sure they sound all right. But apart from that, I live down on the Mornington Peninsula. So if I drive to the city, that's the time that I make phone calls, not listen to podcasts. So I don't, sometimes I listen to some of the ABC ones, the conversations and things like that, but it's not common for me to do that.
Well, I didn't know you had a podcast at the ESF, so I will tune in now that you said that.
Oh, very good. Very good.
Great. So just professionally speaking, can you tell us a little bit about your professional career today?
Yeah, sure. I started as a secondary teacher. And after that, I went into the state government, and all of my career has been not what you know, but who you know. Well, I hope it's a bit of what you know, but mostly it's been who you know. So somebody I knew was looking for someone to do some work a long time ago in the state government and had seen some of the things that I'd done. I ended up heading up the marketing and communications area for a government department, and then for what was called the Occupational Health and Safety Authority. So I did a lot of campaigns and things around occupational health and safety, and I started Workplace Health and Safety Week in Victoria, which is now a national event. And that came about because I was seconded to the UK government for a while, and somebody had been over here and seen some things in Victoria and did some detective work and found out who did them, and that was me. And then I got this letter out of the blue to say, would you like to come and work for us? And I said, when can I start? And I got on the plane and off I went. And so I did that, and I started the workplace awards for the Workplace Health and Safety Awards in Victoria as well. So that was a sort of an occupational health and safety background. And then I got into the emergency services for a while, and I was very involved in that, but it took a toll on me. And I left and started my own consulting business, which I did for quite a while. And that was all about workplace wellbeing. And then I got lonely and sort of started getting back into an organisational space. And I got approached about this role, and I've been here for 4 years and I absolutely love it.
Great. So that's a interesting trajectory that you've had from being a teacher to going into OH&S, consulting, and now leading the foundation. So
I think it's interesting that I've been on both sides of the fence as a consultant. So I've been a client and I've been a consultant, and I find that enormously beneficial, you know, because I can think quite quickly. I can assess something quite quickly. If you're a consultant, you come in, you have to understand the problem very quickly. And I've found that I've been able to use that a lot. It's been good. And, you know, being a teacher to start with, that, you know, I'm not afraid to stand up in front of an audience, and that's helpful too.
It's good to have different lenses to this space. So I've done the same thing. I was working in academia, consulting internally, and now in this role, we you know, are creating awareness and liaising a lot with different organisations to help them understand, you know, what psych health and safety is and looks like in an organisation, how to achieve it. So yeah, that's it's interesting to hear.
Yeah, being a client is a good one, Susan, and that's definitely why we wanted Alicia on board. She was actually a client that used Flourish DX previously, and it's like, well, in a large, complex organisation, so you know, that's just really, really valuable to have on board.
Absolutely.
But yeah, can you tell us, Susan, then a bit about ESF and what it does and the objectives of the foundation?
Yeah, sure. So the ESF is a Victorian-based not-for-profit, very small staff. And it's a really unique collaboration of 14 emergency service agencies in Victoria. And our focus is on prevention and early intervention in the mental health space. So, you know, there's a whole lot of people out there treating people who are sick, and we're saying, well, let's stop them getting sick in the first place. So that's our focus. And when I came on board 4 years ago, that was a total change for the foundation. The foundation's actually been around for a very long time. It started after the fires in Ash Wednesday in the 80s, and it started in the late 80s. And that was because 14 volunteer firefighters died. And at the time, you know, they got nothing. You know, their families got nothing, no compensation or anything. And the person who did the review into those fires was the chief of police at the time, Mick Miller. And he said, you know, hang on a minute, guys, this isn't right. Let's get some money that's left over from the tin shaking after Ash Wednesday. We'll set up a foundation so this never happens again. So the foundation basically did that for a long time. You know, they paid out payments when people unfortunately died in the line of work. Thankfully, over time, the need for that diminished for a number of reasons. One, there was less deaths, and secondly was we were more safety conscious. And secondly, it was because you know, volunteers were covered by workers' compensation and so forth as well. So it was a different environment. So there's no other state in Australia really that has a collaboration like ours. Tasmania has something similar but not the same. We've got 14 agencies, and so they are agencies that work in the preparedness for emergency space, the response space, and the recovery space. And you know, really what we seek to do is not what they do as an employer in the mental health space, but we really seek to get ahead of the mental harm and injury that pervades the sector. And so to achieve this, you know, we lead initiatives, we translate research, we do our own research, and then we translate that into innovative evidence-informed practice. And we try new things that as a single agency, they wouldn't have the capacity to do. And we try things that are going to benefit the whole sector. And that's why we're fairly unique. And, you know, a lot of the other jurisdictions are a bit envious of what we've been able to achieve. And we really have done a lot in the last 4 years.
Yeah, well, definitely psychological harm prevention is the main theme of this particular podcast. Can you give us some examples of some of the more upstream preventative initiatives that you guys have run with?
Yeah, sure. So, well, at the moment, there's 2 things that we're really working on and we're actually fundraising for at the moment. One is a proof of concept for a residential wellbeing program. And so what we're trying to do there is, you know, in my technical language, is to get people when they're wobbly. So they're not clinically diagnosed, but when they're wobbly, and we're getting them in a residential environment where they're working with a couple of trauma facilitators to deal with their personal trauma and to help them develop the skills where they can build their resiliency and self-manage, so that it helps them really process that trauma instead of, oh yeah, I went to that, I'll just put a lid on that, and then some stage later down the track that it all comes bursting out. So the aim of that program is to prevent serious mental injury and mental injury claims, work safe claims. So that's what we're trying to avoid. So that's a really innovative thing that we're doing. We're also looking to start a lived experience program. So whereby we're training people to share their stories safely for themselves and for the audience, and working to set up a network of those people and essentially a library of those stories that are relevant to the emergency services. So the idea of that is that it reduces the stigma, because stigma is a huge issue in the sector. It reduces the stigma of putting your hand up and saying, I want help, and then encouraging help seeking, because these people will be able to tell a story of their journey of recovery and in many instances, post-traumatic growth. So they've really moved on from what they're doing. That's 2 things. A couple of other really upstream things that we're doing, and one that is particularly good is our Leading for Better Mental Health program. And we've done that with support from WorkSafe in Victoria. And what that is, we did a whole lot of research across the sector and said to them, you know, said to all of the agencies, all of the wellbeing managers, what's something we can do that's going to benefit the whole sector? And we had a long, hard think about that in various workshops. And in the end, we decided that the thing that was going to make the biggest impact to the culture of the sector was if we trained team leaders in a new way. So that Leading for Better Mental Health program really helps them become what we're hoping contemporary leadership in the sector will look like. So they're very much more authentic leaders. They're leaders who understand what it means to nurture a mentally healthy workplace, how they influence that environment, you know, what they need to look out for. You know, we're not training them to be psychologists. We're training them to be aware of their own behaviour and how that impacts the culture and what they can do. So there are a couple of things.
Yeah, so those first couple you mentioned were more aimed at, I guess, the individual level, improving, you know, awareness and self-care and whatnot. And we definitely buy into the idea that, you know, when it comes to mental health in a workplace context, that there really is a shared responsibility, right? Yes, the individual can do lots of different things to take better care of themselves and, you know, like you say, catch themselves if they're a bit wobbly and, you know, seek early help.
Interesting you should say that, though, because the wellbeing program we're building this off a model that is happening in Canada. And it's not only having individual impact, it's having profound cultural impact as well, because there's a ripple effect. So it might be the individual who is attending the program, but when they go back to work, the cultural impact is huge. So it's not only the individual level.
Yeah. Okay. So what sort of cultural impacts have you identified from?
Well, I haven't identified anything because we haven't done it yet, but in Canada, they're saying that, you know, people are coming back, and the people who have participated on the program are really behaving very differently in the culture and influencing other people to seek help and you know, tell stories, etc., etc. And it's very much helping in that regard.
So
it's creating, sorry, Jason, this psychological safety in the work. So speaking up more, you know, like you're saying, telling your story, accessing help. I think it's that
stigma reduction is what it sounds like.
It's all of that. It's all of that. And but it is making the individual differences. I mean, I was speaking to a Canadian firefighter for my own our ESF podcast this week, you know, big burly guy in tears he was, telling the story about how somebody had participated on the program, and he was one of the founders of the program, and this firefighter and his wife took him out for lunch afterwards because they wanted to tell him that the program saved this guy's life. As he was driving down the 7-kilometre driveway to the venue for this program, he said he was fighting to keep the car on the road. He just wanted to drive that car into a tree. That's the state he was in. He didn't have a diagnosed clinical condition, never been diagnosed. He was operating perfectly as a firefighter, but underneath, this is what was going on. And he said, you know, this program changed my life. And that's what we're wanting to do here.
Yeah. And that's the thing, right? So we very much subscribe to the integrated model of mental health, which means that, you know, if you think about the mental health continuum, people are all different ends, and people can swing very rapidly, right, without a diagnosis as well, in terms of being either mentally well or mentally ill. And so really you need to have a range of services. So it's really great to hear that you are, you know, taking something that works in Canada and replicating that in Victoria for the people that you serve.
And we're replicating it, but we're building on it, because, so for example, over in Canada, they don't include the partners or a significant other. We are doing that. That's what we will do in our program here very much. So it's a process of continuous improvement. And, you know, they're very much strategic advisors to us, and we're building on that. And, you know, then they'll learn from us, and it'll be sort of this continuous cycle of partnership, we hope.
Yeah, and I've seen some fantastic examples of that in a previous life when I used to deliver a lot of training around fatigue risk management for shift workers. They'd bring partners along to those sessions so they could understand like how the need for your partner to get good sleep and how you could support them to get the sleep that they need, and the linkage between good sleep and mental health on off days as well. So no, it's a really good initiative.
We're running another program at the moment called Mental Health Matters, which is for volunteers. And so in that program, we're actually, the first one's happening next week, but we did it last year as well. But what came out of that program last year was people had said to us, it would be really good to bring partners. So this year we're opening it up to partners. So it's for the volunteer and their partner. And they come along to this program, and that's about signs and symptoms. And we talk to them about their support crew. And so the partner is obviously the support crew, and we want them to sort of understand how they can support and help.
Yeah, no, it's a really great model.
Yeah, so we've got, I guess, supports in our personal lives, and then we've got supports in the workplace. So in terms of supports in the workplace, I think you were talking about Leading for Better Mental Health targeted at line managers.
Yeah.
So from a, I guess, psychological health and safety perspective, if you've got high levels of or good levels of manager support, your employees will fare better in terms of their mental health. So can you tell us a bit more about what that program actually entails and looks like, and how, what are the outcomes?
Yeah, so we've done 2 pilots at the moment. The first pilot involved 52 people from 12 agencies. The second pilot was a single agency pilot. Unfortunately, when we're in the middle of, we were ready to start the pilot, COVID hit. So what was going to be a face-to-face program became an online program, which impacted it somewhat. The second one was a face-to-face program. So that was 2 days, 3 months off to go and practice, and then 2 days again. So it's about helping people understand the workplace factors that contribute to stress. And we talk to them as leaders about, what's within my control that I can do within my team to make a difference. And how do I know what's required? It's not me being, Captain number one. What did Tony Abbott call it? Captain Underpants or something. I don't know what he called it. Anyway, the top dog saying what needs to happen. It's about engaging the team to understand what those issues are. So that's within their control. So we talk to them about conversations and about the need to have conversations, because in the emergency services, as everywhere, people get promoted because they're good at a job. They're good technically. They may not be good at leading people. They may not even want to lead people. They may have no idea how to do that. And that's just not in their makeup to do that. They're just not good at it. But they're great bulldozer drivers, or they're great on the hose if it's a fire hose or something like that. So it's about getting them comfortable with having conversations with people, because some people, I'm not, you can tell I'm outgoing, but for some people that's, horrendous to have to try and have a private conversation with somebody. They say, but that's none of my business. That's none of my business. But the fact is, if somebody's grandmother's dying, or the cat's just died, or mum's been diagnosed with Alzheimer's or something, that doesn't stay at home. That comes to work. That impacts how you work. And you want a manager who really can understand and accommodate and be authentic in how they deal with you like that. So it's about helping them to have those sorts of conversations and understand why that's important from a leadership perspective. And, they go away and we say to them, what's things that you can do in your workplace? Go away, try it, then come back and tell us what worked and what didn't work. And, we work through and we coach them through different things. So they looked at what was within their control, and then they looked at what was outside their control. And they actually did presentations to executive leaders about the things that they thought the organisation needed to do to improve. And as a consequence of those presentations, there's been some, really significant changes in organisations. One organisation's doing a review of position descriptions, for example. Somebody else has set up a volunteer voice team. There's a whole range of things that have come out of that program.
Mm-hmm. So it's kind of twofold, isn't it? You're talking about increasing the capability of leaders to be supportive leaders, not just task enforcers.
And understanding why.
Yeah.
Not only being able to do it, but understanding why it's so important.
Mm-hmm, mm-hmm. And also from an organizational perspective, so those, broader level work factors that influence, how an organization runs and then the impact of that on its workforce. What's at that level, at that higher level, and what can be done to change maybe the system or the processes that aren't really working or that are contributing to stress or negative wellbeing outcomes.
And what's really unique about the emergency services, and especially when you think about volunteer organisations, nobody joins a volunteer organisation to be a HR manager. they join a volunteer organisation because they want to get on a chainsaw and cut down trees after a storm, or because they want to, fight fires or whatever it is. But, some of them invariably end up being captains of teams and brigades and units, and suddenly they're HR managers. They might be the local plumber or the local butcher or the local hairdresser, and suddenly they're a HR manager for a really complex group of people from their community. And that's very hard.
Mm-hmm, mm-hmm. So because you're doing this as maybe a pilot program, or obviously it's not mandatory training for all line managers at this stage.
No.
Who are the managers that got selected for or took up? Because what I've found in the past, having worked in industry-based research and run integrated mental health interventions at that leader level, it's not mandatory. You have expressions of interest, or you say, this is a research project, program, etc., etc. And we found the staff that kind of put their hand up are already open to this. They're already aware of some of these issues, that factors they want to improve. And then it's almost like the people or the managers that really need to do this, that don't have awareness, that don't have the knowledge, that don't self-reflect.
The ones who need it aren't the ones, yeah.
Put their hands up. So it's like you're missing a whole bunch of staff that actually
need
want
it.
to benefit, and organisation as well.
So in the pilot program, there was a little bit of that. There was some people who put their hand up. Some agencies nominated people who they saw as wellbeing champions. They hadn't necessarily been trained in this though, but they saw them as wellbeing champions. And that was great. There were some people who were tapped on the shoulder and told to go. And so that was a challenge for us as facilitators, sort of getting them through that. So there was a real mixture of people, and that's always a challenge when you're doing a pilot program. But where we're at now is, we're doing the evaluation of the program, and we're really developing, the learnings from both of the pilots. We're creating a program outline that we hope will be a sustainable product, if you like, that we can offer the agencies and say, here's some different delivery options for you. How do you want to do that going forward? So we've built the evidence to show this really works. This model really works. Do you want to do it? Do you want to embed that into your organisation?
Mm-hmm. Yeah, and it's up to that individual organisation to think about,
Yeah, but they like what they've seen.
Yeah. Mm-hmm.
Yeah, so it sounds like that Leading for Better Mental Health program is really hitting at a key psychosocial hazard, which is, leadership support, leadership behaviours.
Absolutely.
But I guess, what are some of the other common psychosocial hazards that emergency service workers might experience in the line of their work?
Well, work demands. Think of work demands over the over COVID. It's incredible. Absolutely incredible. I mean, I had a senior police officer said to me the other day, we've got people who haven't had a weekend off for 12 months. The demands are incredible. And for the paramedics at the moment, people sick and blah, blah, blah. There's so many things that they're really, really under pressure. So that is really important. I'll be honest and say poorly managed change. People find that really difficult, and there's been a lot of reform across the sector. But it is those relationships, and we know from the data that we get about claims and so forth that is a real issue, because as of February this year, 24% of all mental injury claims in Victoria were from emergency service employers. A quarter of them were from the sector. And that's up from 15.5% 2 years ago. So, there's some COVID in there. but there's other things as well. But the majority of those claims, most people think the claims from the sector are traumatic incidents, and yes, that is a problem. But the majority of claims relate to factors such as workload and interpersonal conflict.
Mhm.
And, you know, we've got a problem in the sector because when you have a major disaster, you have a structure of command and control like the military. You know, you do that and you do that and you do that, and I'm telling you what to do. And don't question me. Now, you can't manage like that in a contemporary workplace. So you've got an organisation that is used to that sort of command and control, and then we're asking them to be more contemporary, authentic managers. There's a real sort of conflict there, if you like, in terms of style. So we're really, through that Leading for Better Mental Health program, trying to develop, as I said, a new contemporary sort of style of leadership for the sector.
Yeah, and it's sorely needed. It's something that's been brought up by a number of people. Carla Kapanekia was another one when, talking about the psychosocial hazards and what are the biggest risks for people's psychological health and emergency services. You automatically think about exposure to trauma.
And
some of those
massive.
things.
That's massive.
Yeah.
You know,
Yeah.
I've been speaking to people today, and, you know, I was speaking to a paramedic this morning about his story. And he said to me, for him, it's the suicides that are a real problem. And a lot of these people live and work in the same community. So before he was a paramedic, he was in the construction sector. He had lots of connections in the community. You know, he's turning out to suicides of men that he knew in that former life. And, you know, that's just awful. Or Black Saturday, you know, they live in the community. The community is devastated. The workers are devastated. There's no mental space because you can't leave work and go home and get some space. You can't go into work and get space because they're both just in chaos. So it's a mixture of things.
Yeah, so I guess the trauma is definitely a foreseeable risk by the employer, and a lot of these employers, to their credit, and services like your own, offer help or training or preparation for people, and obviously screening of people to make sure that we're recruiting the right people who, hopefully are going to be less susceptible to injury from exposure to trauma. But I guess it's the boring things. It's like you say, it's the HR things, the interpersonal issues, the workload, the poorly managed change. It's the same thing that we see in any workplace, which also has a detrimental effect on people's psychological health.
And Julia Gillard wrote in the foreword of the Answering the Call report that was done on the emergency services nationwide in 2018, an amazing benchmark study of 22,000 people. And she wrote in that forward something that I use a lot. And she said that a supportive work culture is like giving everyone in the organisation a mental health inoculation. And we all know about inoculations at the moment. So wouldn't it be great if you could go in and give everybody a jab and say, there's your mental health inoculation? But, it's not that easy. So we know that
there'd be a lot of people pushing back as we've seen from the Pfizer jab and all the rest as well.
Don't give me the mental health inoculation. I want to be sick.
You're going to be tracking me.
Yeah, that's right. So it's about workplaces that are supportive, inclusive, have regular conversations about what's going on in the workplace and how that's affecting people, have much lower rates of problems.
Yeah. And just before we move on from that, having worked it quite extensively with a policing organisation in Victoria and done a lot of research before rolling out interventions, the organisational factors, these work-related factors that are HR-based, actually, the evidence shows that they have more of an impact than exposure to trauma. So it's really, really important not just to focus on that exposure to trauma, but to actually look at all of the relevant work factors. And from what you've said, how do we actually increase that job control from a worker perspective, especially when there's those hierarchies and that type of workforce or workload management, where it's kind of, I say, what goes, and how to break those barriers down.
But imagine this, imagine you're exposed to trauma. Imagine you're the police officer who every shift is all they're dealing with is family violence stuff, So they've got that sort of thing, or there's been a particular traumatic incident and they go back to the club or the station or the brigade or whatever it is, and there's some dinosaur leader there who says, look, suck it up, sunshine. I've seen that all my life. This does not help.
Yeah, no, that's very unhelpful.
Yeah.
We've heard quite a bit about a couple of programs that are happening at the foundation. What's actually forecast for the foundation? What's in the pipeline? What's next?
Well, what's next is really that wellbeing program, that residential wellbeing program. That's on our agenda. The lived experience program, we're fundraising for those at the moment. We're actually, we've got this amazing thing happening later in the year called Tony's Trek, where our chairman, who happens to be the Inspector General for Emergency Management in Victoria as well, he's walking 1,500 kilometres from the State Control Centre down to Malakuta, so in the far east of the state, over the ranges, up to Wodonga and back down to Melbourne. So he's going into the areas that were affected by the summer fires a few years ago. And he's doing that. It's about 1,440 kilometres, 50 days, and we're raising money for that. The other area of interest is families and the impact of emergency work on families. And we've done a qualitative study on that ourselves. So we know what the problem is. We know what's needed. We're working on a resource for them at the moment. And we want to do something for children as well, because, children who are in a family where there's a parent who is severely impacted by mental ill health, it impacts their childhood basically, and we want to do some things to support them. We're not at that stage yet, but that's on the agenda for us.
Yeah, so quite a bit of focusing on the support services or support programs.
Well, yes, really prevention. It's about preventing the mental health having the serious impact. Preventing and early intervention is the focus.
And also you said that leading for better mental health at that line manager level, that program is going to be evaluation. Yeah,
absolutely. We want to see that more widely implemented.
Well, I'll be tuning in to seeing how that gets rolled out.
Yeah, given your own experience, Alicia, like you said at the police, I'll be interested to see that line manager intervention deployed and the findings from that.
Yeah, definitely.
Susan, one of the questions we like to ask all our guests on the podcast is thinking into the future. What are your hopes for workplace mental health, particularly in the emergency services sector, given the topic of today?
Look, in this sector, we have to drastically reduce the number of claims. We have to drastically reduce the number of people who are so seriously ill that they're putting in a mental health claim. That's really where we've got to be. And I gave you some statistics before about how terrible they are and that the claims are related to workplace issues. So, that's what we've got to turn around. I mean, I'm not saying we've got to continue to treat sick people, obviously, but we've got to just transition back and take a step back and go back to the very start upstream and say, well, what are we doing to prevent this happening in the first place? And, if you look at things, I think the government, the federal government announced a lot of money recently going into programs. They're treatment programs. They're not programs that are helping people at the prevention end. And I think we're sort of a bit ahead of the game here in the thinking. And, people know that that's the right thing to do. but we've really got to shift the focus so that we've really got so much more effort going into that area.
Yeah, it's a good ambition. We need people in emergency services, and we need to do better to protect them, as you say.
Yeah, absolutely. I mean, if we need the emergency services in Victoria, there's 125,000 emergency workers. 100,000 of those are volunteers. If they are not mentally fit, we're in the poo. What happens, when there's a disaster?
Yeah. So just before we wrap up, Susan, for any professionals wanting to work in the psych health and safety, workplace mental health space, particularly in emergency services or more broadly, what would your advice be to those people?
Well, there's certainly plenty of work.
It is expanding, isn't it? Yes.
There's plenty of work, and it's obviously a growing interest, area of interest, but it's draining work. I mean, I've forgotten the exact
Susan.
I've forgotten the exact statistic, but over the last 12 months, somebody told me that a third of the registered psychs had left the sector. So is it any wonder that the mental health system is under so much pressure? There's just not the people there to help people. And in our sector, one of the things that we're really doing through the Responder Assist program through Phoenix Australia is making sure that the people who are treating people in the sector actually know what it's like to be in the sector. So they're doing a lot of work to make these treating psychologists and counsellors and everything culturally very much more aware, because the feedback coming from the sector is, what's the point of talking to this person who has no clue what it's like to be a police officer and what we have to deal with every day. So that's something that's happening in the sector, which is really good.
Yeah, well, Susan, it's been a fantastic discussion with you today. Thank you so much for your time. Where can people learn more about the ESF?
esf.com.au. Just have a browse through our website. Very easy. Yeah.
Yeah, no, we'll definitely put a link in our show notes, but it's a really important topic. As you said, if we didn't have emergency service workers, we would be in the poo. I mean, in Australia in the last few years, I think Australians are so thankful that we've got, great volunteers who are helping, in the wake of floods, fires, pandemics, all the rest. So they do amazing work, and we need to do better to look after them.
And they're just ordinary people. They're just ordinary blokes and women doing an incredible job.
Yeah, absolutely. Well, again, thank you so much, Susan, and we'll definitely put some links to your work in the show notes. But for our listeners, don't forget that when we do these interviews with our guests, we do record them over the Zoom. So if you prefer to take on the video medium rather than the podcast medium, you can head over to the Flourish DX YouTube page and check that out. We'll also put up some of the best clips from today's episode on the Flourish DX LinkedIn page. While you're over there on LinkedIn, Joel and I and Alicia spend a fair bit of time on the platform, probably too much. So feel free to drop into our DMs and continue the conversation there. But thanks again, listeners. We'll catch you next episode.